Just right when I'm shooting this video, my mom is here cleaning this room. It's been more than 1 month, and now let's talk about this tretinoin cream. Hi, if you watch my videos, you probably know that I got my hands on this tretinoin cream, and then I've started using it for a month. And yeah, now I think I can share my experience and review with you guys. I'm gonna talk about everything that I know about retinols and tretinoins and my experience, and overall what you can, like, who can use it, who cannot, and basically everything. So that's why this video is gonna be a bit long. You've gotta catch up with me, and yeah, without any further ado, let's get started. Before starting the video, you should know that what are retinoids and who can use retinoids and etc etc. So retinoids are vitamin A. They are derivatives of vitamin A, and then there are two kinds of retinoids. One are prescription, and second one are like over the counter. Prescription one contains like tretinoin, that is like this. There are some other categories of prescription retinoids also. And then there are over-the-counter retinoids, which are like adapalene, and then there are some other big names. I'll share everything with you guys. Brands are selling retinoids that are over-the-counter retinoids. This means those are less irritative. They are effective, but they are gonna take more time than the prescription retinoids. They are mild. So yeah, these are the over-the-counter retinoids, and there are prescription retinoids that are strong, that people like cannot use without a prescription. We have to see a dermatologist, and then if he or she allows us, like prescribes us to use that, then we can use it. But there are some people who like try prescription retinoids just like me. So yeah, I got my hands on this prescription retinoids, means it is tretinoin. A tretinoin cream, 0.025%. And yeah, now let's like start with my journey. Before starting with my journey, I'm gonna be too frank with you, and I'm gonna tell about every details and everything about this cream. First, I watched a video, like more like a shorts of Dr. Dre, saying the prescription retinoids, especially she talked about tretinoin cream. Obviously the tretinoin cream, people like if you are so like afraid of using tretinoin cream on your face, I mean, if you are like young, or if you don't know if retinoids is a thing for you or not, what you can do, that you can use this cream, apply this cream on all over your face, and leave it for 15 or 20 minutes, and then wash it off, and then apply a mild moisturizer. Then again the next day, or maybe a few days later. She didn't say the days or everything, but I'm saying like what I did. I followed her because I don't know how my skin is gonna react with retinols, and I have no idea because I've never used any vitamin A based skincare products in my on my skin before, like never. Even when I used vitamin C serum, I have no idea about vitamin C serum, so I directly used 20% vitamin serum, and that was the worst tragedy of my skincare history. But then I know what I was doing wrong. But yeah, see, even vitamin C, the strong vitamin serum, I was afraid of that. And whereas this tretinoin cream, this is super irritative, and it keeps skin peeling and everything. So I was like really afraid of trying this, like putting this cream on my face. So what I did, I take the cream obviously on my palm, and I take less than a pea size amount. Like, so imagine a pea size amount, like this much is a pea size, like a pea size amount is a pea size amount. Then I make a half of it, and then I try half a pea size of amount on my face, and then I leave it on, like I'll tell you every details here, I'll show you everything. Then I leave it on for exactly 20 minutes, and then I wash it off. And one thing also, this cream is extremely drying. So when I tried it on my completely dry face, I tried this on, and it was giving me horrible tightness, and my skin was too dry because this cream is too drying. Okay, so I leave it on for 20 minutes, and then I wash it up, and then I put my moisturizer on, and then I sleep. And I did it on February, and that time it was like cold. But right now it is March, and it is pretty hot. My next application, I leave it on for 30 minutes, and it was good. Like, it didn't give me any sort of irritation, everything was fine. And then on my third, on my third application, it was on the 7th day, I think. I leave 2 days in the I put a 2 days gap between every application. So on my third application, I don't know what happened to me, but I leave it on for like an hour, and then the next day it gave me so many purging, like it was more than, I think, 20 purging on my face. But there's a best part about purging, that the purging kind of heals, it kind of goes away within 2 to 3 days max. And like that time I was like so worried, and I'm like, did I do something wrong, or did I leave this strong cream on my face for too long? And I remember it even gave me some skin peeling around my nose, like especially here, and I'm like why is this happening to me? Like, I have no idea. Then I don't know what happened to me, but I was so afraid that I completely stopped using it for more than a week. Then after a week, I tried to use it in a sandwich method, which you should use if you are a beginner with tretinoin. But I followed Dr. Dre's video as a beginner in tretinoin, that leave it on for few minutes and then wash it off and let your skin know that you have applied retinols on your face. That is how you can introduce tretinoin into your skin. That's what I did. But yeah, it gave me so many purging because I leave it on for an hour, obviously, and yeah, it was obviously irritated that day. Okay, so after 7 days later, I tried to put this on in a sandwich method, but this time I've tried so many soothing, peptide based, hyaluronic acid based, like so many soothing and calming skincare products, and then I layer it on. But on my first application, it gave me 1 or 2 purging. One was here and another one was here, I remember. Then again, after 3 days later, I put it on in a sandwich method again. This time it only gave me only one purging here. I think here or here, I forgot, it was a long time back. Then on my third application, I again use it, like after 3 days later again I used it again in a sandwich method with so many peptides and soothing and calming skincare ingredients, and then it gave me nothing. My skin gets adopted with tretinoin. So yeah, this is, I think, a victory for me. It didn't give me any acne because I don't have acne issues. What I get is purging. I only get purging. So this is the story about me and this tretinoin cream. We are almost kind of besties because it doesn't give me any sort of breakouts or anything or purging if I use it. Like right now, like I'm totally fine with it, but everyone's skin type is different. The methods work for me may not work for you, and the methods work for you may not work for me. So this is a relation. Don't just watch my video and buy tretinoin and start using it. Try to watch their videos with whom skin you can relate. Like everyone's skin type is different. I have oily combination skin. Then try to watch their video who got acne prone skin or extremely sensitive skin, and if you have sensitive skin, then you can relate to her videos or his videos or whoever it is. But try to watch multiple videos before you start buying tretinoin. As for my skin, I have oily combination skin, but I don't know, like my skin is, I don't know, but I have oily combination skin. But in winter my skin becomes more like normal skin, but in summer my skin shifts to the oily combination skin, and in monsoon my skin shifts to more of a oily skin, because in monsoon, I don't know, I get the most of the oiliness I got in monsoon than in summer. So my skin kind of shifts from in winter normal to in summer oily combination to in monsoon extremely oily. This is my skin criteria, and I tend to change my skincare products according to the season. But yeah, this is everything that I'm gonna tell you. And one thing also, many of you, like when I posted that video that I'm gonna try tretinoin, I'm gonna start using tretinoin, many of you have told me that don't use it, or many of you have suggested me the ways I can use it. Many of you suggested me to use adapalene. Adapalene is less irritative and it doesn't cause that much skin irritation. And I forget the name, but a girl, she DM'd me in my Instagram saying, please girl, don't use tretinoin, it delays your period cycle and it kind of gets into your bloodstream. Don't use tretinoin, use other form of retinoids. Like I can use the minimalist retinoid. Like she suggested me to use minimalist retinol cream or something. I don't know, like I'm forgetting this, but she was so sweet and she was so kind to me, and that is why, like, I have no idea what I should do. Like, you guys tell me what should I do. Many of you have, like, there's a girl, I don't know her name, I think her name is Dot, something like this. So she told me that she was using tretinoin, like she's still using tretinoin, but she thinks that it kind of, this tretinoin has like delayed her period cycle. She don't know if it is a tretinoin or not, but she's assuming that it is because of the tretinoin she's getting late period cycle. And I don't know, I want to use retinols, I want to use tretinoin, but I don't want to disturb my period cycle. Like, it is fine, my period cycle is fine right now, but I don't want to disturb this anyhow. So please, just if you know anything or if a doctor is watching my video, please tell me, is it true that tretinoin delays the period cycle? Because if it does, I'm gonna stop using it immediately. Please just tell me and let me know. But I've know like multiple dermatologists who are using tretinoin. Obviously they are dermatologists, so they know how their skin is and how they should use tretinoin. And as I told you before, like everyone's skin type is different, so I don't know what I should do. Like I want to try tretinoin. Like I'm still afraid, but yeah, I'm still using it. I'm still using it. So yeah, now let me show you how I use it, like how I layer it. Now let's use tretinoin. So first I start off this Keep Cool and Soothe toner. Next I follow it up with my snail mucin. These are all soothing and hydrating sort of products. Right after that I use this Prepteronic serum, hyaluronic acid serum. Obviously you can obviously skip this serum part, but I'm using it anyway. And next I'm using this eye cream. This is not an eye cream, this is Cosrx all-in-one cream. I use it as an eye cream and I'm kind of protecting my eye and nose areas. Yeah, next I use moisturizer. This is Minimalist Ceramide Moisturizer, and I try to use so many ceramide and peptide based serum. Yeah, next this is the moment. I'm spilling it out, but yeah, I take this pea size amount and then I rub it off. Like see, this is the amount I use, and wow, this looks so bad. Like see how I'm applying this product on my face. I am only using it on my forehead and on my cheeks and under my chin area a bit. I am not using it around my eye area or yeah, basically the sensitive parts, because this cream spreads, this tretinoin cream spreads, so it's better not to use it on the sensitive area parts, because our under eye area is like the skin under our eyes is really sensitive and it's really thin. You can put Vaseline under your eyes too if you are thinking it is gonna be too much for your skin. So yeah, that's how I use it, and then I let it sit on my face for 10 minutes max, and then I follow it up with this Claire's Midnight Blue Calming Cream, because this cream has peptides and it is so soothing. And one pro tip, try to use a moisturizer that has ceramide and peptide in it. And yeah, I am sinking into peptides and ceramide today. Lip hydration is important too, so I'm using here this Laneige lip sleeping mask. This sleeping mask doesn't contain any sort of active ingredients, and yeah, as I told you before, this cream spreads, so it's better to protect your lips. And the next day you have to use sunscreen, because tretinoin are mild exfoliant. They kind of moves the dead skin layer from your upper skin. If you cannot use sunscreen, then you can use this minimalist sunscreen stick, but you should use and while you're using tretinoin, do not use salicylic acid, vitamin C serum, AHA or other strong low pH actives on same night. My skin loves toner. That's why I tried to use it with multiple toner. First I tried to use it with this Keep Cool and Soothe toner, and it was completely fine because it is soothing sort of toner. Next I tried to use it with this Mochi toner, and it was again fine. It didn't give me any sort of purging, and everything I tested on after the tretinoin was completely fine with me. And next I tried one with this ginseng essence water, and it was again fine, didn't give me any sort of purging. All of this toner, I tried to test these toners after I was okay with this tretinoin cream. Now let's talk about who can use tretinoin cream. If you are in your mid-20s to late 20s or early 30s, this is the best time for you to start using retinoid. But if you're afraid of prescription retinoid, you can anytime buy the foxtail retinoids, and there are like minimalist retinoid. There are like so many retinoids that you can try on. You can try the adapalene, or you can try over-the-counter retinoids. If you are afraid of trying prescription ones, I am trying this prescription one because I want to try it on. Like there are like I've seen so many influencers, so many YouTubers are like they are using tretinoin cream, especially the 0.025% one, and then they shift to 0.05% one, and then they shift to 1% one. They are making thousands of videos regarding this topic, and I don't know, like I really wanna try it too because I'm curious. And then someone texted me saying it is not a fun product that we apply and make reviews. This is a serious skincare stuff, and this is a prescription serious stuff. This is not a fun product. I agree, this is not a fun product, but come on, like I'm 23 years old. Like this February I turned 23, so I wanna try this globally popular product on my face and see how it reacts. And so far it is not giving me any sort of purging, nothing. My skin is coping up with it pretty finely, and I think it loves me, and I somehow love it too. But yeah, if it causes me any kind of health issue or delaying my period cycle or anything, I'm gonna stop using it right now. But I want someone to confirm me. I've read multiple of articles, and some articles are saying that there are no such like evidence that it delays this sort of things. Then there are some articles saying maybe it can delay the period cycle for some people, and then there are some articles saying it gets absorbed in the bloodstream and it's so harmful to us. So that's why it is a no for pregnant women, or mom to be women, or breastfeeding women. It is not for them. And I just don't know, like, should I continue using it, because my skin is pretty fine with it. But if you like, I'm telling you girl, like, if it is gonna cause me any sort of health issue, I'm gonna throw it away right now, like. But I need like strong articles, and yeah, even doctors are using it comfortably, so I don't know. But then there's again a fact: skincare is highly subjective. This is it. Yeah, if you like this video, don't forget to like this video. And I don't know what I talk in this video. I don't know. It's been only 1 month, and no, I haven't seen any sort of anti-wrinkle effect. Come on, I don't have wrinkles. Seriously, I don't have wrinkles. And no, I did not see any sort of brightening or anything, because I already use so many brightening, not really brightening, but so many soothing, calming, and this sort of products. So the soothing, calming, and brightening products are enough to brighten up my skin. So yeah, I did not see any difference. Like, my skin was same as it was 1 month ago. I did not see any sort of difference, because how can I see any sort of difference? I need time. Like, I think at least 5 to 10 years to see any difference, if it does anything to my skin or not. So don't just ask for any answer right now, because I really don't know if it did anything. Like, see the proof. Like, I have this proof. My face is the proof. Like, watch the 1 month ago video again, and then watch this video, and let me know if you can see any difference or not, because honestly I don't see anything. So yeah, that's all. And my mom is still here. I don't know, like, why you have to do all the course right now. Yeah, this is it. If you like this video, don't forget to like this video, share this video if you want to, and I'll see you guys in the next video. Till then, take care and bye.